Are you 65 or turning 65 soon? Then you need to give Medicare expert Myriam and her dream team at United Insurance Experts a call today. They specialize in Medicare and will guide you in making the right choice for your specific needs. One plan doesn't fit all. United Insurance Experts offer you choices: Blue Cross, Humana, Aetna, United Healthcare, and many, many more. Call Myriam at United Insurance Experts at 561-464-CARE. That's 561-464-2273. Medicare can be very confusing. Myriam is here to help. Call Myriam today at 561-464-CARE. That's 561-464-2273. Myriam will educate you with no obligation on your part. Or visit UnitedInsuranceExperts.com. 561-464-CARE or UnitedInsuranceExperts.com. United Insurance Experts is headquartered in Boca Raton and licensed nationally, speaks English, Portuguese, and Spanish. Good morning and welcome to Medicare Made Simple with Medicare Myriam. Medicare Made Simple is brought to you by United Insurance Experts. Call today 561-464-CARE. That's 561-464-CARE. Now here's Medicare Myriam.
Good morning, everyone, and thank you for tuning in. I'm your host, Miriam Leva with United Insurance Experts. United Insurance Experts is not affiliated with or endorsed by the government or the federal Medicare program. We do not offer every plan available in your area. Currently in Palm Beach County, we represent 10 organizations which offer 49 products. Please contact Medicare at 1-800-MEDICARE, or you can contact them online, medicare.gov, to get information on all of your options. The purpose of this show is to educate you on Medicare and to connect you with valuable resources. So today, I will be discussing Part B premiums, IRMMA charges, the process of appealing an IRMMA charge, and Part B coverage, and address some of the questions that I've received this week. So let's get on with this, and let's focus on Medicare Part B, right? Because there's a lot of confusion on what these parts are. Part A, I'm just going to quickly mention it. Part A is what you're entitled to, which is a premium-free part because you've already worked for it, right? Free, I don't know how free it is if we already paid into it, right? So Part A moving forward is free. Part B does come with the cost. Now, Part B focuses on outpatient care. It's covering services like doctor's visits, preventative care, and some home health care. Beneficiaries typically pay, again, a monthly premium for Part B coverage. Please remember that Part B offers 80% coverage, with you being responsible for 20% of the cost. Additionally, Part B currently has a $240 deductible starting in 2024. So as of this year, Part B does have a deductible of $240. Keep in mind that this might change in the following year. Enrollment is automatic for those already receiving Social Security benefits. So what do I mean by that? So if you're collecting Social Security prior to age 65, automatically you're going to receive that red, white, and blue card that says Part A and Part B. Now, this only applies to those that are receiving early Social Security benefits. But I always advise my clients or anyone to just double check, right, that everything is in order and in place. But if you are collecting Social Security benefits, again, it should automatically come in the mail. It's going to come to the address listed with Medicare. And it'll be that red, white, and blue card that says Part A and Part B. Now, there are times where you would enroll in Part B. So if you did miss that enrollment period, you can enroll during the general election period that runs through January through March 31st. So just keep in mind, if you did miss that enrollment period and you're not, you don't have a special election period, you could always enroll in the general enrollment period. So again, just to recap this, $240 deductible for Part B. Part B does have a premium. As of right now, Part B's premium is $174.70. Now, this is the standard rate for Part B. Now, I did want to mention for those, and I actually forgot, but I do want to mention for those that want to see if their Part A and Part B, if you're eligible and enrolled for Part B, you can look this up on your Social Security account. I highly recommend that you have an SSA.gov account. And the way to locate this Medicare number or to see if you're enrolled, again, you would go to SSA.gov. You can look under your managed benefits and information. There's something you'll see a link that says Get Benefit Verification Letter. So you can click on that, and it will open up a letter that you should have received or you will be receiving from Social Security, letting you know that your Medicare is in place and active. And it will say your Medicare number on there and then your Part A and Part B effective date if they are effective. If, let's just say, you're already on Medicare and you just want to know where it is, there's under summary of benefits, you'll see it should say in green enrolled, and then it'll say something like Part A effective date and Part B. I always tell people that, are collecting Social Security early and they just want to know, they don't want to wait till the last minute and they just want to make sure that their Medicare is in effect. I always recommend that you go to your Social Security account and go under Medicare and look at your benefits, your summary, and just see if you're Part A and Part B, if you're enrolled, and it actually shows an effective date. If you have any issues finding this, my advice is to contact your agent if you're already working with an agent, or you're welcome to call United Insurance Experts at 561-464-2273. We'll be more than happy to help you with this if you can't locate it. But again, everything's on your Social Security account or your Medicare account. Okay, so that's just one thing that I wanted to go over. But let's talk about the Part B premiums. So as of this year, it's $174.70. Typically, Part B is deducted from your Social Security check. If you're not collecting Social Security, you will be billed quarterly. Now, I get a big confusion with this because a lot of people call me up and they're like, oh my God, Myriam, I just received a bill for $524.10. Well, that's not monthly. If you're paying the standard rate of $174, they multiplied that by 3, which gives you that $524.10. And if you look at that letter, it will say that it's covering 3 months. It would say like benefit period, and then you'll be able to see the 3 months on there. And that's how they bill you if you're not collecting Social Security. So typically Part B comes out of your Social Security check. But again, if you don't collect Social Security, they're just going to send you that bill. Okay. And it is quarterly. And so don't be afraid if you see that big amount, because typically it is for 3 months. Now, the Part B premium does vary based on your income. So the Social Security Administration assesses your adjusted gross income from 2 years prior to determine if you will incur an income-related monthly adjustment amount, which is called IRMMA. So it's IRMMA. That stands for, again, income-related monthly adjusted amount. So there are people out there that pay more for Part B. I'm saying $174.70, but that's just the standard premium for Part B, and this is for Part B only. There are people out there that pay more for Part B based on their income. Now, again, Medicare is looking back 2 years, and I'm actually going to go over that table with you so you'll have an idea of what Part B is. So again, this is for 2024. The Part B total premiums for high-income beneficiaries with full Part B coverage are the following, okay? So if you're filing as an individual, and this is for your tax return 2 years ago, so if you've made less than or equal to $103,000, you will be paying the standard rate of $174.70. If you're filing jointly, you're just going to double that amount. So 103 times 2, right? Because you're filing jointly, it's going to be $206,000, or greater than 206 and less than or equal to 258,000 as a couple, you'll pay $244.60. If you made greater than 129,000 and less than 161,000, your premium for Part B is going to be $349.40. If you made greater than 161,000 and less than or equal to $193,000, your premium for Part B is going to be $454.20. If you made greater than 193,000 and less than 500,000, Now, these are individual, right? $559 is your Part B premium. And then greater than or equal to $500,000 as an individual, you'll be paying $594 for Part B. Now, this is the same Part B that an individual that makes under $103,000 will be paying $174.70. But for those individuals that have high income, they're going to be charged with that IRMMA charge, right? That income-related monthly adjusted amount. So those people are going to be paying a higher amount. So before you sign up for Part B, it's always a good idea to look at this table. If you have any questions about this, you're welcome to give us a call, 561-464-2273, or you can contact Social Security before enrolling in Medicare. And just because, as you know, I'm sure most of you know that you can do this online. You can look it up online. The information is on there. You can get that information there, or you can contact Social Security directly. They'll be more than happy to provide that information and go over this table with you. Now, keep in mind that you can appeal. You have the right to appeal an IRMMA charge if you feel that it's inaccurate. The way that you file an appeal is filling out Form SSA-44, which is called the Medicare Income Related Monthly Adjusted Amount Life-Changing Event Form. Now, there are multiple ways you can provide this form to Social Security. You can physically drop it off at your local Social Security office. You can fax it or email it. I actually have a copy of this SSA-44 form. Again, it's called the Medicare Income Related Monthly Adjustment Amount Life-Changing Event. And I'm actually going to read to you guys what it says on this form. So it says, if you had a major life-changing event and your income has gone down, you may use this form to request a reduction in your income-related monthly adjustment amount. Okay, so this is important. If you had a major life change. So what are they saying major life change is? So marriage, divorce, death of a spouse, maybe you stopped working, work reduction, loss of income based on a producing property, loss of pension income, employer settlement payments. So anything like this based on this form will qualify you to apply, right? So if you've had any of these situations and you have an IRMMA charge, there is a form out there that you can fill out and actually send into Social Security, and maybe you can get your IRMMA charge waived or maybe lower. So it's important to understand this. If you have any questions, we'll be more than happy to help you with this, or you can just contact Social Security directly. I'm sure they'll be more than happy to help you out. So just to go over this, if you do have an IRMMA charge, again, you are welcome to fill out this form. Again, you can fax it, mail it, or just visit your local Social Security office. I am going to go over also a few questions that I've received this week. One of them is, if I'm on Medicare, how do I get dental and vision care? Now, there's a few ways you can get dental and vision care. One way is if you have a supplement plan, we can add vision and dental to your supplement plan if your supplement plan offers this benefit. Now, not all supplement plans out there offer this benefit, but if you do have a Medicare supplement plan, you can add it if the carrier offers it. Another way is if you have a Medicare Advantage plan. Most of these plans offer dental and vision, which is included within the plan. So my advice is, if you want to know if your Medicare Advantage plan offers it, just look at the back of the card. Give them a call and just ask, does my plan come with dental and vision? And maybe you could just start using those benefits, or contact your local agent to find out if your plan offers it. Another way is go directly with a private insurance company and purchase a standalone dental. Now, these are many ways that you can get a standalone dental and vision. Just keep in mind that I'm referring to vision and dental care. A lot of times Medicare does cover like cataract services as of right now, but it doesn't cover for you to go to your local like Target or Costco or Walmart for you to go get contact lenses. So you see there's a difference. This is vision care, and then dental care, like if you need a root canal or an extraction or a crown, this is what I'm referring to as dental care. So again, you can purchase a standalone to go along with your original Medicare, or if you have a Medicare Advantage plan, you can look into the plan that you currently have and see if it does offer these services. Or during the annual election period, you can make a switch if you are interested in these type of benefits. So my second question is, I have a penalty for late enrollment on Part D, but I had employer coverage. What do I do? Okay, I've actually seen this a lot, unfortunately. If you have a late enrollment penalty and you feel this is incorrect, what you need to do is contact Social Security and let them know you had coverage throughout that time. So you see, Medicare doesn't penalize you if you've had credible coverage. You can fill out the Part D late enrollment penalty reconsideration request form. If you're working with an agent, you can also contact them. I'm not sure if they'll be able to help you, but most agents out there, especially us, if we are your agents, you can call us. We'll be more than happy to help you with this. Or you can call the insurance carrier. So if, let's just say, you're with company A, you can call, again, the back of the card, member services, and say, hey, look, I've been paying this penalty. I just don't feel that I'm responsible because I had coverage throughout this time. So they should be able to provide some guidance to you. To go over that Part D late enrollment penalty, which you can find online. It's in the Social Security website. Again, the name for the form is Part D late enrollment penalty. You can fill it out. You could also hire an attorney, I believe, to file this appeal for you if you feel that you shouldn't be responsible for paying this penalty as you had coverage and you could provide proof, or for whatever reason you have. So just to go over this form, it's very easy. It's a 2-page form. They just want your information. Of course, they're going to want your Medicare number. Then they're going to want like things if you had credible coverage in the past. So one of the check boxes is, I had other prescription drug coverage as good as Medicare, in parentheses, credible coverage. So that's one of the big things. If you've had credible coverage and you have a penalty, you just have to prove to Social Security. That's why I always advise everyone, if you're enrolling in Medicare, provide them with this proof before you enroll. Why? Because you don't want to be, with this whole penalty thing, you don't want to receive a bill and be like, okay, you owe such and such amount because you didn't have coverage throughout that time. So it's extremely important that you do it right the first time. And if you don't, it's okay. You just have to provide that evidence, right? And this is one of the forms that you can fill out, that you've had credible coverage. A lot of times they do want proof from the employer themselves. You would need them to sign off on it or provide that proof, right? A letter on their letterhead stating that you had coverage throughout that time, right? So that's extremely important that you attach this evidence. There are other reasons why you're not subject to this penalty or why you shouldn't be, but you can pull this form, or if we're your agents, you can contact us and we'll be happy to provide this form for you. So that's that. I do want to remind everyone about the annual election period that's coming up October 15th through December 7th. Now, this is a crucial time because there's a lot of changes to Medicare for the new year. So for 2025, we're going to see some major changes. I know last show, I think it was like last 2 shows, I talked about the changes to Part D. But there's changes overall. everyone that's on a Medicare Advantage plan or a Part D plan is going to be receiving a letter around the third week of September that's called the Notice of Change. So this is in regards to you and your insurance carrier, what changes are coming up. So let's say your doctor, I'm going to give you some example. Maybe the doctor's no longer in network. Maybe your prescription drugs are no longer covered, or maybe your prescription drugs are the cost went up, or maybe your premium went up. So it's extremely important that around the third week of September, let's just say the second to last week of September, you keep your eye out for this letter. It's called the Notice of Change. It's going to come directly from your insurance carrier. And believe me, I get it. You're going to receive tons of mail. Everybody does during this time because there's a lot of propaganda out there trying to get you to change. You don't have to make a change if you're happy with your plan. And when you receive this notice of change, if there's not really a big change, or maybe the change is beneficial to you and you want to continue with this plan, you can do so. I get a lot of people that says, Myriam, do I have to make a change? You don't. If you're happy and it's providing the coverage that you need, you can continue without a problem. What I'm trying to say is, please make sure you compare and look at this, because if there is a change and then you go to the next year and you're kind of stuck with this plan, then it could be an issue, right? If your doctors are not covered, or if your prescription drugs are not covered. That's what I'm trying to say. That just make sure you speak to your agent or speak to your insurance carrier, or call United Insurance Experts at 561-464-2273. Again, there is no charge for us to review your insurance plan. No charge. You will never receive a bill from us. Another thing is, there shouldn't be any agents out there charging you for this. There's a lot of scams out there. Just know that they're not allowed to charge you to put them on a plan, because the way that they get compensated, or the way that an agent gets compensation, is directly from the insurance company that they're signing you up with. Okay, so again, there is no charge for this. United Insurance Expert is happy to help anyone that has any question. You don't even have to sign up for a plan. If you just want to compare it, we'll let you know if the plan you have is the best one for you, and we could do a thorough comparison on the plans for 2025. Again, the annual election period runs from October 15th through December 7th. This is the time to switch, drop, make a change. Again, October 15th through December 7th. We're happy to help you. If you're already working with an agent, let them know ahead of time. Make that appointment, because this is the time where agents are going crazy, because especially this year, as there's going to be so many changes. So again, any questions, let me know. I'll be happy to answer anybody's questions. Please send in your questions. I love hearing from you guys. Again, Myriam Leyva with United Insurance Experts. You all have a lovely weekend, and I'll talk to you next week.
Thanks for listening to Medicare Made Simple with Medicare Myriam right here on Legends 100.3. Medicare Made Simple is brought to you by United Insurance Experts. For more information, call 561-464-CARE. That's 561-464-CARE. Tune in next Saturday at 9 a.m. for more Medicare Made Simple with Medicare Myriam. Are you 65 or turning 65 soon? Then you need to give Medicare expert Myriam and her dream team at United Insurance Experts a call today. They specialize in Medicare and will guide you in making the right choice for your specific needs. One plan doesn't fit all. United Insurance Experts offer you choices: Blue Cross, Humana, Aetna, United Healthcare, and many, many more. Call Myriam at United Insurance Experts at 561-464-CARE. That's 561-464-2273. Medicare can be very confusing. Myriam is here to help. Call Myriam today at 561-464-CARE. That's 561-464-2273. Myriam will educate you with no obligation on your part. Or visit UnitedInsuranceExperts.com. 561-464-CARE or UnitedInsuranceExperts.com. United Insurance Experts is headquartered in Boca Raton and licensed nationally, speaks English, Portuguese, and Spanish.